Good morning, everyone. Good morning, ladies and gentlemen. Good morning, dear colleagues, honored committee members. It is an absolute pleasure for me today to present to you the complex exam, or as we call it as well, the 6th progress report of our really great gastroenterology group, with the title, as you all know, From Science to Society. First of all, and I think this is the most important part as well of today, I would like to congratulate you and thank you all for your really outstanding work you have done in the last 2 years. In the next few slides you will see what I really mean with this outstanding work, and I think it's very evident once we see the publication and what you already have achieved in this really, let's say, quite short time. We are all here united in one common vision. What is our vision? Absolutely clear: science into healthcare. But what does it really mean for us? For us, this means there is an absolute need for innovation and improvement from channeling back the already known science, already known data and facts which are out there in the databases, to channel it back to healthcare and patient benefits. This slide really well shows there is an absolute need for this. It shows that 2/3 of all deaths under 75 in the EU could be avoided if the knowledge which is already out there is actually used and it's channeled back to patient benefit. An absolute astonishing number. 1.2 million deaths under 75 could be avoided, once again, if the knowledge which is out there is actually used for patient's benefit. One may ask, translational medicine, that's nothing new. This already exists. If you look up translational medicine, maybe in the 90s, you could come across something like this as a model. A very fragmented, very phasic model from T0 to T4. In average, this may take more than a decade, 13, 14 years, until basic research findings are actually, in the end, the benefit for the patient and channeled back. So that's why our head of the department, Professor Peter Hegi, together in a collaboration with Academia Europaea, was asked to come up with a new model. And they came up indeed with a new model. It is a cyclic approach, the cycle model, new cycle model of translational medicine. Let me tell you a few words about this and what this means for us. For us, everything starts at healthcare. Healthcare means bedside, our day-to-day practice, where we face our patients and face the difficulties the patients have and we have as physicians. So of course, from these problems in day-to-day life, questions arise. These questions we bring back to our group meetings, project meetings, and to our team. Together, we develop scientific questions and answers to this. These answers lead us to knowledge. But knowledge alone, what is it good for? If it's only stuck in your own head. In German we have a saying, if a tree falls in a forest and no one's there to hear or see it, did it really fall? So you could say knowledge by itself, only for yourself, what it good for? So we need communication of the knowledge via publication. And only through this way it can actually be channeled back to patient benefit, and this is what we are ultimately here for. And we are very happy that this cyclic model was awarded a Nature publication. Let me give you 2 examples now of how quick the implementations can occur. This is a beautiful example about ENT surgery around our team of Tamas Horvath and Kata Ilesh at the Bacsi-Sielinski Hospital. They did a huge meta-analysis investigating what is the best way to operate a cholesteatoma. And they came up with a solution that a complete obliteration of the cholesteatoma is the way to go. At this time, Kata was our first year PhD student. After the first year, she went back to the clinic, and in her first year then in the clinic, so second year of her PhD, they already implemented her findings, and by the first year, by the end of her second PhD year, in their clinic, they were already able to see a 13% decrease in the recurrence of cholesteatoma. So absolutely quick, the implementation for patient benefits. Another really astonishing finding and results which was able to achieve here is around the team of Andrea Parnitsky at the Heimpal Children's Hospital here in Budapest. They investigated kids with cystic fibrosis and went against the guidelines. The guidelines say that you should start screening for diabetes mellitus with 10 years of age, but they started much earlier. And by this approach, they were able to identify 14% newly diagnosed diabetes mellitus and 16% with impaired glucose tolerance before any symptoms occurred. So by this, postponing the onset of the disease and negative symptoms for the patient for many more years and saving quality of life and many well-spent years in life. Now I'll tell you a little bit about the, let's say, rather hard facts and numbers. Together, before all of us, we started a Center for Translational Medicine at the Page University in 2019 with 20 students followed by 17 students. In 2021, the Translational Medicine Center moved to Semmelweis University. In the year I started, we were 91 students, and you are currently the year of 2022 with 84 students you started. This is an example of not only your year's achievement, but the general achievement within the last 3 years. So as you can see, I think this speaks absolutely for itself. Outstanding publication, JAMA Oncology, JAMA Pediatrics, and we're incredibly proud of the gastroenterology paper as well. Not that it's really one of the best journals in gastroenterology, but we had also had the honor to have the cover page of gastroenterology. Further critical care, e-clinical medicine, further outstanding publications. This is how our PhD program is built up. Most of you are very aware of this. So this is not that cyclic as the translational, but this is a phasic model. So you can see in the first year we have 4 phases. Each phase is concluded by a progress report. So in the first year you have 4 progress reports, and in the second year where you are right now you have 2 progress reports, and you conclude your second year with the 6th progress report with the complex exam. For every progress report we have a requirement for you what needs to be achieved. By this, as you can see, you can pass further on. From the 84 you started with, currently you have 68 students which were eligible for the complex exam. Let's see how many there are at the end of this week. So today is already the last day, but with this great group, I'm pretty sure we can also get all 68 to pass the complex exam. Further, some hard facts just about your year. So as we saw before, the 84 students you started with, 139 projects are currently running. An absolute astonishing number. From them already published 17 D1 and 8 Q1. Further, 1 D1 is accepted, and under revision we have 3 D1 and 4 Q1. So congratulations really to all of you for this really great work. These are some numbers of the best publication from only your year. So with this we can see critical care, Crohn's and colitis, so also really top journals so far. Once again, congratulations. Not only do we believe in the translational medicine, but also by learning from really well-known scientists. With them we can see here also Nobel laureates and really well-renowned scientists, like for example Professor John Wong, which we had the opportunity to see just this year from the University of Singapore, or also this year the Nobel laureate Professor Brian Kobilka. So all of us have great opportunities to really learn from the best. We also like to award, of course, excellence and recognize excellence. So every year, every week, every month, every month, we award the best statistician, best student, and best supervisor. Of course, science is important, but there's more in life than science. But within science, within the community of the CTM, we have really great and amazing activities and adventures like this Halloween party, or also, what is always a great anticipated event is our Gatsby party once a year. As you can see, the head of our department here as well. And you can see it's just really great fun. So for every one of you, please join us for the next ones. Science is important, having fun is important, but sports, of course, as well. So we also do offer a huge variety of different sports activities, a hiking club. We also play squash, have a cycling club as well, and running. I will tell you a bit more about the cycling in a few further slides, because the cycling is also quite a big event once a year, the Challenge Day, but I'll tell you a bit about this in the next slides. So not only this, but there's also an absolute outstanding environment here. Our students were able to achieve 3 times the best poster prize at Semmelweis Symposium last year, and some of our students were awarded with a scholarship for the Harvard Methodology course. So again, congratulations for this. To put it in the words of Randy Sheckman, Nobel laureate, he said, "I wish there had been opportunities like this when I was young." I think hearing this absolutely speaks for itself. That's amazing. So, I said something about the Challenge Day before. This year we have the Challenge Day on the 19th of August, and I need to say, indeed, it is a challenge. We did it last year. One day, a whole trip around the Balaton on bike, more than 200 kilometers, but it's absolute great fun. So everyone who feels up for this challenge, please join us this year. You won't regret it. Maybe one day after. So just a bit, what happened during this week? On Monday, as you all know, you had the written exam. Congratulations again, every one of you passed the written exam. On Tuesday, we had the honor to see a really great lecture about epidemiology and neonatology from Eruca Jante. This was followed by Esther Salai's PhD defense. Once again, congratulations, Esther, for passing your PhD as well on Tuesday. And then together, communally, we watched Germany against Hungary, the Euro Championship match. Then yesterday we were able to see the presentation of Professor Dorobantu from the University of Bucharest, and today we'll have the honor to listen to the presentation of Professor Oltaffer from the Asklepios campus in Hamburg. So just a few rules and the housekeeping information. Every presentation will be 10 minutes and it's followed by a 20-minute discussion. As you can all see, you have these question cards, a part of your attendance. You will have 3 QR codes presented. The first QR code will come right after my introductory talk, and then the other 2 throughout the day. You need to collect all 3 QR codes, plus at least need to ask 1 question for the full attendance. As you know, our innovation, which is now already 3 years old, let's say, if you have 3 questions, since all of you have 3 question cards in the pocket, you will get the Excellent Question Award, which is also then contributed with a bottle of really delicious Bock wine. So once again, thank you very much, all of you, and good luck for today.